When cavities are present in the mouth, whether it's 1 or 15, if they're all at the same developmental stage, they have the potential to heal simultaneously. The challenge with preventive approaches is that you'll never see direct evidence of what was avoided, but that's part of the natural healing process. However, there is a clear sequence and pattern that occurs with dental decay. Statistical data shows an interesting trend. When examining the number of fillings in different age groups, teenagers aged 17 to 21, adults aged 30 to 50, and seniors, the amount of dental work consistently increases with age. A closer look at these statistics reveals that a filling starting as a single surface procedure can progress to a 2-surface filling, then a 3-surface filling, or eventually require a crown as time passes. The translation of this data is straightforward. Teeth experience deterioration and require increasingly extensive dental work year after year. This progression highlights why early intervention is crucial. When told it's just a small filling at a dental appointment, this should prompt careful consideration about whether that filling can be prevented through natural remineralization processes. Even after receiving a filling, protecting that tooth through comprehensive oral care with regular xylitol use and controlled eating habits can prevent additional dental work. Modern technology allows for early cavity detection. Advanced intraoral cameras and highly sensitive diagnostic equipment can identify cavity formation in its earliest stages. Initially, this seemed like a promising development that would enable people to address damaged areas and avoid fillings entirely. However, over the past 15 years since this sophisticated equipment became available, it has primarily been used to initiate dental fillings earlier, particularly in certain countries. This makes patient education and empowerment essential. Patients should feel confident asking their dentist whether a filling is truly necessary, with emphasis on the word need. To have an informed conversation about fillings, it's important to understand the distinctions between cavities and caries and how these differ from actual fillings. There is indeed a point where a filling becomes necessary, but there are many stages before that where a cavity can be reversed by addressing the dental caries, the infection that causes the hole in the tooth. With adequate time, though not necessarily a long period, teeth can heal themselves. When this occurs, the tooth returns to a pristine condition, as healthy as any other tooth. It's also worth understanding that most cavities take longer to form than previously thought. While it was once believed they developed in 2 to 3 years, current knowledge suggests the process typically takes about double that time. This provides ample opportunity to implement preventive measures and avoid cavities and fillings indefinitely. This isn't something predetermined by genetics or chance, it's a process that can be interrupted and reversed. The process of a tooth requiring a filling begins with an infection. Within the biofilm, the layer of bacteria coating the mouth, certain bacteria process sugars and carbohydrates, forming acids from these substances. When these bacteria remain stuck against a tooth, the acids demineralize the enamel, pulling minerals out and leaving porous, demineralized areas on the side or top of the tooth. These locations are common sites for decay because plaque bacteria accumulate on the sides of teeth or in the grooves on top, and wherever bacteria accumulate, demineralization occurs in the enamel surface beneath. On an X-ray, this demineralized area appears quite black, resembling a hole. However, it's actually composed of numerous tiny channels where minerals have been extracted from the tooth rather than an actual cavity. Many times, what appears as a large black hole on an X-ray is simply an area where disease has begun attacking the tooth, not a true hole. For a tooth to heal from this condition, specific processes must address the disease known as dental caries. Dental caries consists of disease-causing plaque bacteria and the softened tooth structure, essentially weakened enamel that has created these compromised areas. When a dentist drills into such an area, they remove the damaged structure, clean the space, and place a filling to restore the tooth's appearance and function with either a white or silver material. At this stage, however, it's still possible to stop the disease by preventing plaque formation so no additional acids penetrate the tooth, and by remineralizing both the tooth surface and underlying structure, minerals can be redeposited and the tooth can become completely whole again. Many dentists, particularly in countries with socialized medicine such as Australia and New Zealand, typically avoid drilling into enamel. They recognize the value of demineralized enamel, understanding that it retains structural integrity and can be readily repaired through proper oral care techniques when action is taken promptly. The situation becomes more concerning when the demineralized area extends deeper into the tooth, reaching the dentin. This understandably causes anxiety because if left unaddressed, the tooth's nerve, which isn't far away, could be seriously damaged, potentially killing the internal nerve and allowing the decay process to continue. If the nerve is at risk, toothache typically develops. Usually, consuming anything sweet, carbohydrate-rich, or cold will cause pain lasting approximately 2 minutes. This indicates that the tooth's internal nerve is affected, a serious warning sign. At this point, not only might a filling be necessary, but a root canal may also be required. When a dentist prepares the filling, there's a significant chance of disturbing the nerve inside the tooth, or the nerve may already be compromised and need root canal treatment. If decay has progressed far enough to affect the nerve, even after filling the tooth, it will likely remain problematic eventually. Therefore, the sooner an opportunity is given for the tooth to heal, provided there's no acute pain and only perhaps some sensitivity when consuming sugar, the better the outcome from making preventive changes. Without these changes, natural healing won't occur, but by using comprehensive oral care products, controlling eating and drinking to meal times, and maintaining proper oral hygiene routines, decay can potentially be stopped and reversed. Before beginning this process, it's reasonable to ask a dentist how long they believe would be appropriate for attempting remineralization. Whether dealing with 1 cavity or 15, if they're all at the same developmental stage, they can all heal simultaneously, which is quite remarkable. For those told they need 8 or multiple fillings scheduled, why not dedicate 3 months to this approach? 12 to 24 weeks is often sufficient for most people to arrest the disease and begin remineralization, which benefits the tooth regardless. Even if a dentist ultimately decides to place a filling, the time spent between detection and the next appointment working on remineralization can significantly improve the situation. The speed at which many teeth heal is remarkable, though results vary by individual and circumstance. If there's a large, visible hole in the mouth that won't fill back in completely. The discussion here concerns intact enamel with internal demineralization. Without intervention, the compromised tooth structure disintegrates, and this collapse is what truly defines a cavity, the caving in of that portion of the tooth. Even in cases requiring filling, comprehensive oral care can ensure the surrounding enamel remains healthy and strong, which dentists find remarkably beneficial during procedures. While large missing chunks of tooth structure cannot be rebuilt, demineralized and carious areas can be remineralized, even when they extend into the dentin, through proper techniques. This is possible because certain oral care solutions, particularly those containing xylitol, can penetrate deeply into carious areas inside the tooth, working within those demineralized channels.